Dr. Aseem Sharma. How are you, Doctor?
All good, Kahan. My pleasure. Thank you.
Pleasure to have you here. I'm really stoked.
The honor is mine, by the way.
I don't think it's necessary for me to tell the audience even that you're a dermatologist because it goes by your look and everything that comes with. But yes, you are my dermatologist, and I came across you 3 months ago.
Absolutely.
I came to your clinic, and the first thing I told you is that you're like the Andrew Huberman of dermatology. Not just from the look, but because you're bringing skincare tips and knowledge to social media in the simplest form possible. So, really happy you could join us. So, tell me, how are you? How's life treating you?
Oh, life's good. Swinging. I'm doing wonderful work, like you said.
Yeah.
And I get to meet interesting people like yourself.
That's right.
Happy.
So, I did some intense research on skincare, and I'm really all amped up about this topic. So, we're gonna go through the basics of skincare and what it is like to deal with oily skin, dry skin, scalp issues, and everything in between. And I'm gonna have you derm-splain a lot of concepts to me. Tell me, did you coin this concept?
I did.
Really? It's an original?
Honestly, yes, it is. I don't know if anybody's taken it because I didn't trademark it, but it's something I thought of because so many patients ask us to dumb it down, right?
Yeah.
There's so much jargon floating around, so many words floating around, and we learn medicine in Latin. That itself becomes very technical. So many of my patients tell me to dumb it down.
Okay.
So I thought mansplaining, dermsplaining, this is the perfect portmanteau.
Yes, yeah, I really like the phrase, and
thank you.
I think you should trademark it because somebody ought to steal it really soon. So tell me, is the journey to becoming a dermatologist the same? Medical school, residency, is it all the same?
It's always the same. So you need to go to a good medical school to do dermatology in this country, to do a legitimate degree. There are a lot of non-qualified dermatologists also floating around, and that you can do with a simple 6-month course. But it shows. It shows by the way you practice, by what you bring to the table to patients, and patients kind of see through all of this now. And we live in an era where information is key.
Right.
So people understand if you're well-read, thorough, a good professional or not. So yes, started my journey from medical school, and my life has been a mixed bag when it comes to dermatology. Where I started off in an Armed Forces Institute. I served the Indian Air Force for 8 years.
Oh wow!
Then I moved to a demi-government setup where I taught other residents dermatology. So I was an assistant professor in a government college.
Okay.
And I'm heavily into academic research. It's always I've always been very fond of research and science and what goes on behind the simple things that we do in life. So that curiosity helped me spend another 7.5 years in a medical college teaching.
Okay.
And I finally now have my own brand. I've had it for about 5 years now.
Skin Saga,
which I co-own with my wife, who's also a dermatologist. Although we keep things separate and delineated at the clinic so that we don't fight.
Of course. Necessary. So tell me about the Indian Air Force. I had no idea you had done that. What was that experience like?
So post medical school, I did my MBBS, my basic medical training from Armed Forces Medical College, which is in Pune.
Right.
And then I served for 8 years in the Indian Air Force. I was a general medical officer, but with a penchant towards dermatology. So I would do a lot of skincare research in the interim. But then I finally did my Doctor of Medicine or MD in dermatology once I left the forces.
Okay. Wow.
So I was posted to various places in the country.
Like what? Where?
I was posted to Sirsa, Kanpur, Gurgaon, Thane. My last posting was Mhatre, which is very close to us right now. And that is the reason why I settled in Lokhandwala, which is where I am at present as well.
That's pretty cool. And Skin Saga is based in 4 Bungalows.
In 4 Bungalows,
yes. Adjacent to Lokhandwala. Did you meet your wife along this process of doing research in skincare and dermatology?
Interestingly, yes. So like I said, I was running this fellowship course in trichology, hair disorders, in Sion Hospital, where I was an assistant professor at the time.
Okay.
And she came in as one of those students, a post-resident student.
Right.
So she's been practicing for as long as I have.
Yeah.
But we met during the course and sparks flew, and we're still together. Very happy at that.
This is a story for the ages. I'm happy that's a story I've never heard before.
So between us, we have 3 fellowships, 3 degrees, and a good baby of our own, which is Skin Saga.
Okay.
So, no, not the baby you're thinking of.
I was about to ask, so many fellowships and degrees. Is there a child between this couple?
No, we're not the kid kinds, and we do believe that we like spending time with each other. We dedicate a lot of our lives to dermatology as such.
Mm-hmm.
Not only the clinic, but also academic commitments. I write quite a bit.
Okay.
So I have 5 books of my own. Nutrition is something which I've recently coined, like a new project which I just finished.
That's been your latest venture.
That's my latest venture. I'm a chief editor for this book called Nutrition in Dermatology.
Okay.
And that's something which is quite close to my heart. And the kind of lifestyles that we live. See, the whole thing about skin is it is complex, right? It's the largest organ of your body.
Mm-hmm.
But a lot of what you see on the skin is actually stuff happening inside.
Yeah.
That's what I try to bring out in this book. And I have a lot of good experts in the field who came together to write this book with me.
Mm-hmm.
And yes, I also travel the world with my wife. We give a lot of lectures. I am invited to a lot of international and national conferences to deliver lectures on topics that I'm an expert at.
Yeah.
So that does consume a lot of time.
Is Korea one of the leading countries in terms of skincare?
Recently, yes. Korea was one of the first countries essentially to bring in that minimalistic skincare.
Right.
So you look at the bottles, you look at the packaging, it's very minimal. White, black, transparent, not too colored, not a lot of fragrance. And products which essentially are clean. And they were also one of the first countries to develop the very famous 10-step routine, which none of us can practically do.
Yeah.
But they're also, they essentially brought that whole, logic to the mix, that whole thinking that you can do multiple layers. Instead of doing one single thick layer on the skin, do multiple small, less potent things put together in layers on the skin. So all your double cleansing, layering, all of that comes from Korea.
Very interesting. And they also sell the dream of achieving glass skin. And
which again, if you see, Kahan, if you look at our skins, between us, the both of us have combination skin, right?
Yeah.
Combination to oily. I know your skin type and I'm telling you mine.
Yeah.
So we'll always have these small pores, no matter what we do. So we can come close to Korean glass skin, which is poreless, shiny skin with a good light reflex, but we'll never achieve it in toto because that's not who we are. We're racially precluded from having Korean glass skin.
We're all a slave to our genetics. And one of the main reasons I have so much respect for dermatologists is you can give a diagnosis based on just 10 minutes of an interaction with someone. You get to know their diet, their genetics, their skin history in very minimal amount of time. And to give an accurate diagnosis is quite a task. And I think good dermatologists do it well. So kudos to you on that.
Thank you. Diagnosis is half the battle won, right? If I can't gauge what you have, how am I supposed to treat you, right?
Yeah.
That's what I said. It's a little, we've oversimplified it over the years. We feel dermatology is a very easy branch to do. It's actually one of the toughest things to do.
Yeah.
There are patients floating around with no diagnosis whatsoever. Multiple skincare tips and tricks tried and tested. A lot of home remedies thrown in the mix thanks to COVID. But they're still roaming around with no diagnosis and no treatment.
And many people are opposed to going to a dermatologist thinking that, oh, my ancestors had good skin and they didn't need to go, but they don't live in the same environment and same conditions that we do today. So I want to get to natural products. I want to get to nutrition, all of that. But let's start with basic skincare. I am a teen or late teen going through acne, oily skin. What kind of skincare would you suggest for someone living in a metropolitan city such as Mumbai?
Great question. So for a younger person starting out, you're a tween, obviously, I know that. But then
I'm 20 now, so I'm past that.
You're past that. Tween, that's why I said tween.
What is tween exactly?
Tween is teens who turn 20.
Okay, cool.
Yeah, I thought you were more woke than I am.
I didn't know this was woke, but you learn something new every day.
I hope I'm right.
I hope so too.
So anyway, so coming back to your question, so a girl you said?
Girl or guy?
Okay, so why I asked that particular question was with women, with young girls as well. The minute they start chumming, hormonal imbalance comes into play.
Right.
So a lot of times, acne that we see on the skin could be hormonally mediated.
Okay.
We obviously, somebody living in a metropolitan city is exposed to stress, is exposed to pollution. All of these things kind of stimulate the oil gland to produce more oil, hence giving more acne. There is also a key role that inflammation has to play. If you're a reactive type, if you genetically are predisposed to acne, then you'll be an inflammatory skin type. So these things will give you more acne. So these are a few ground questions that I would ask somebody who comes.
Can you explain inflammation? Because we hear this term thrown around so much.
Yes.
Explain it to a 10-year-old.
Okay, so my body has immune cells which are supposed to fight. For example, if I have a bacteria which comes around on the skin, or I have a fungal infection or a virus which comes to the skin, my skin is supposed to fight it out.
Okay.
I have these cells called T cells and B cells. Obviously, I'm diving too deep, but I have certain cells which form my immune system which fight this. What happens sometimes is there is no stimulus as such.
Yeah.
You don't have a bacteria or fungus roaming around on the skin, but my skin still reacts. That's called a reactive skin or inflammation.
Okay.
And that inflammation is skin deep, but as such, you can have inflammation all across the body. And one of the major, when we talk of longevity and early aging, premature aging, we're now speaking a lot about inflammation which is happening throughout the body.
Yeah.
That's where your microbiome comes in, your gut comes in,
Right.
your gut-brain-skin axis comes in. So that's where it gets a little more mucky. But
Definitely.
inflammation for a 10-year-old is your body reacting when there's no stimulus.
Okay. Inflammation is your body reacting when there's no stimulus. Got it. So, okay, your skin is oily and you're in a city with pollution, bad air
And
quality.
humidity, which is what sets us apart from the rest of the country.
Yep, Mumbai has probably the highest humidity one of the highest humidity in the country. That leads to hair fall as well.
Yes.
And bad acne. So tell me, how do you deal with oily scalp because as a teen, your hormones and, suppose in a guy, high testosterone levels is going to lead to a highly oily skin. So how do you deal with that?
So like you rightly mentioned, why teenagers get more acne? Nowadays, we're having acne which is adult in onset, where people have acne right up till the age of 45, 46, even up till 50 in some unlucky individuals. But obviously, lifestyle is at play there, apart from the usual stress and strain of daily living. But in a teenager, where testosterone levels just start to boost when you're 12, 13, that's when the acne starts, because testosterone or androgens, the male hormone, it essentially stimulates the oil gland to produce more oil, and it makes the oil glands bigger.
Okay.
Which is why sometimes, again, genetically mediated or through stress or through diet, you can have a range of acne. Somebody can get away with simple blackheads and whiteheads, which is grade 1 acne. Somebody would have a pus-filled lesion. Somebody would have a big cyst or a nodule, which are extremely painful. You would have seen people around you.
Yeah.
So, again, genetically mediated susceptibility, which is the backdrop for all of this, which is then compounded by daily life, where you have stress, pollution, ultraviolet radiation, and compounded with so much skincare which is available. Sometimes you're just not using the right products
for your skin type.
That also is something which increases acne. But to answer your question very simply, for a young boy or a young man getting acne, I would look at dairy. I would look at an excessive use of whey protein. I would look at fubbing, is it called, when you're looking at reels all day long?
Scrolling.
Okay.
Yeah. Doom scrolling, they call it.
Scrolling.
Yeah.
So when you're scrolling till like 4 a.m. in the morning, 4 a.m., so it's got to give, right?
That can cause acne as well.
If you're sleeping for 3 hours only,
right,
you will produce more of a hormone called cortisol, which is your stress hormone.
Right.
Cortisol is what wakes us up in the morning and keeps us going throughout the day. If I have too much of it produced in my blood because I'm not sleeping well, my body is fighting to keep me awake. That itself can stimulate oil glands. What I'm trying to say is, what you look at on the face has such a complexly deep-rooted pathomechanism going on inside, which is why this becomes so complex.
I agree, yeah. It can be something, one thing in your diet or 10 different lifestyle choices that you're doing wrong.
I have so many Jain patients who come to me, right?
Yeah.
And they go on these paneer diets because that's high protein.
Right.
Fair enough, but paneer is also dairy.
Yeah.
And that high amount of dairy can stimulate your insulin glands. It can basically stimulate insulin receptors to produce more insulin.
Okay.
That itself can cause more acne. So you cut down on the paneer a little bit, add other plant-based proteins, and lo and behold, your acne is gone.
Cool. Gotcha. All right. So let's go through a basic skincare routine.
Okay.
We have face wash
Done.
daily, twice a day, thrice a day. Moisturizer, depending on your skin type, dry or oily. What kind of moisturizer, what kind of differences would you look for in a moisturizer if you have dry skin?
So for dry skin, you want a gentle cleanser.
Hmm.
You already have dryness, right? You're not able to hold moisture in the skin.
Yeah.
So I would want a gentle cleanser, something which is non-foaming.
Yeah.
And I want a thicker moisturizer, something which is basically laced with ceramides or hyaluronic acid or a combination thereof. I would want multiple things in the moisturizer. It should be thick enough to seal moisture in my skin. My skin, I need something to seal it so that it locks the moisture in.
Okay.
Whereas for somebody with oily skin, I already have enough oil floating around. I can't make the skin more greasy because a heavy moisturizer will make you feel very greasy and more sticky. So in that case, I'd use a heavier face wash, which is where your foaming face washes come into play, and a lighter moisturizer.
Interesting.
Like a Hydra-based or a water-based moisturizer.
Yeah. And there's no such case, right, where the T-zone is oily and the cheeks.
Absolutely. That's what we both have. That's combination skin.
But, okay, combination skin as in your cheeks are dry, but your T-zone.
Precisely. So this is called the U-zone, the forehead and the nose. Cool. And the U-zone is your cheeks right up till the chin. So most of the times in India, as a race, we have combination to oily skin, which means all of our T-zones shine bright after 3-4 hours out in the sun. Yeah. And the U-zone gets drier. So that gets tricky because you can't use a very heavy foaming face wash. Obviously, I can't give you a split face wash, right? It'll be too much of a routine. Then you're moving towards a 10-step routine.
Yeah. So I don't see how someone can only use a face wash on half their face.
So there you have two strategies. You either use a non-foaming, like a gentle cleanser and a heavy moisturizer throughout the face. Okay. Or you do a morning an AM PM thing. Right. Use a heavier foaming face wash in the morning and a lighter gentle cleanser in the evening.
Cool. All right.
But that will be 2 face washes and 2 sets of moisturizers. So depending on how people are comfortable. So what I'm trying to say is for combination skin, you err on the lighter side.
Yeah. Got it. And tell me how important sun protection is. Because that's the step that's neglected by most metrosexuals.
Absolutely. So sunscreens are non-negotiable for me. The first time when you came to me, do you remember? I told you the first thing I'm going to get you on is a sunscreen, then we'll discuss the other things that you need.
Yes, I remember.
So that's usually how my conversations are with my patients, or when I'm doing any of these podcasts or educative videos. I always say that your sunscreen is the major thing. Even if you talk about acne, so UV radiation, especially UVB, also stimulates the oil glands to produce more oil. So if I'm doing that, I'm cutting one step less. Plus, which means I'm protecting the oil gland from a trigger, which is the sun.
Right. Cool.
I'm trying to protect it from other triggers as well, which is hormones, stress, sleep, and diet. But the sun is a major trigger. Okay. Plus, we are a pigmented race, right? We're a darker skin race as Indians. So, we are prone to pigmentation. So, if I'm using sunscreen, I'm also able to prevent that.
Does sunscreen reduce the melanin levels in your skin?
No, it reduces abnormal melanin production. Got it. So, I won't produce melanin. See, if I get a zit, it will not turn into a mark if I'm using good sun protection.
Okay. Cool. And what comes after moisturizer and sunscreen?
That's it. You go about your daily routine. Everything else which comes, they're called actives. So like you rightly mentioned, a simple skincare routine would be a cleanser, moisturizer, sunscreen. Between the cleanser and the moisturizer, you have these actives based on what skin type you have. So for example, if you're oily and I want to give you something to exfoliate the skin, I'll give you something like an alpha hydroxy acid or a beta hydroxy acid or niacinamide, which is doing very well these days. And
those are all active products that you use after the moisturizer.
Before that's usually used. They mostly come in serum forms. They come in creams and gels also. So you always follow the rule of light to heavy. Okay. Your cleanser is the lightest thing. If you are using a serum as an active, that comes in between because that's water based. Then come your moisturizers, which are either oil in water or water in oil formulations. They're thicker. And your sunscreen is the last step.
Okay. And are these actives, as you call them, preventative, or are they best used if you have oily skin?
Some of them are preventive as well, especially at lower concentrations. But when we have higher concentrations, those are mostly like they fix things. I wouldn't say they cure things. Curative is a wrong word to use, but they fix things for sure.
Cool. Got it. All right. So that covers the skin. Let's move on to our hair and scalp cleanliness. So living in a city like Mumbai, you need to have a clean scalp, which if you don't is going to lead to a whole sea of problems. So tell me, oily scalp and someone like me, long hair. I don't want you to think that I wanted a consultation and didn't want to pay for it. So I called you on a bloody podcast.
You
podcast.
already paid me, so it's fine.
Right. So tell me, long hair such as mine,
Yes.
I tend to suffer from oily scalp. The weather being how it is, and I exercise often. So, what would you suggest for someone like me who exercises and has oily scalp?
So again, with the scalp, things become a little more complicated because your scalp skin is different and the hair are different. You could have oily scalps with dry hair.
Yeah.
You could have oily scalps with oily hair. You could have a dry scalp with oily hair or a dry scalp with dry hair.
Four combinations.
Four combinations. So 4 different strategies there as well. So there your cleanser becomes your shampoo.
Okay.
That's the best cleanser for the scalp.
Right.
So if you have a very oily scalp, again, you'd use things which are sulfated. You'd have to, I'm going on camera and saying this. You
use shampoos that have sulfate in them.
Yes, at least once a week.
Okay.
We've really come to this era where we're negating sulfated shampoos like anything. I have to really coax my patients to get on a sulfated shampoo. If you have so much oil that is coming off as flakes, it's that typical wet dandruff which you scratch, it comes under your nail. You need a sulfated shampoo to remove all that buildup. All the silicone-based products that we use, all the gels that we use, all the styling serums, all the, the various, I'm not going to take brand names obviously, but you understand, all the plexes of the world, so to speak, all of these cause buildup.
Right.
Something's got to remove that buildup. So at least once a week, you should use a sulfated, regular, old school shampoo. And the rest of the days, especially if you have hair which are dry, you'll use a regular, mild, non-sulfated shampoo.
Okay.
So what I'm saying is there's a place for everything in skincare.
And how often would you suggest washing your hair with shampoo?
At least 2 times a week. For slightly longer hair, I recommend 3 times a week.
Okay. And the days between that, do you recommend washing your hair with water?
Yes, just a simple rinse. Nowadays, you have a lot of these baby shampoos which are rechristened as gym shampoos. They're called workout shampoos. So you can actually shampoo on a daily basis with shorter hair. The problem with longer hair is that your hair gets very frizzy.
Yeah.
Every time you wash it, even with a non-sulfated mild shampoo, it is going to remove some extra moisture from the cuticle, from the outside layer of the hair. So the more you use gym shampoos or daily based shampoos, the more frizzy your hair gets.
Does washing your hair with water every day not make the hair shaft weaker?
No. In fact, the contrary. So if you lightly massage your hair when you're, rinsing your hair with water, it removes that early buildup.
All right.
So it's very good initially, but obviously it's no match to a shampoo. A shampoo does 1,000 times what you can do with simple water.
Yeah. Okay. I'm glad we have that myth debunked. And tell me about conditioners, the next step.
Okay, so anybody with your hair or mine, slightly longer, you need conditioning to remove frizz.
Right.
So what happens every time you shampoo? You're losing water. So like I told you, the skin, you keep losing water. So you have to seal it with a moisturizer for dry skin.
Correct.
So the same thing happens with hair. If I'm stripping away moisture because of regular shampooing and the daily runt of life, I will need something to seal the cuticles. Okay. The outer layer of the hair, I need to put something on that which will prevent water loss and lend water to the hair. So the hair is less frizzy. Frizzy hair means the cuticle is, so think of it like a tube, your hair. The outside part of the tube is a cuticle. Okay. Once that opens up, it becomes porous. Your hair becomes frizzy and easily breakable, very brittle. So to prevent that, you layer it with something known as a conditioner.
And what about girls? Girls dealing with hair fall in a high humidity city? Very
common again. The reason again there is brittleness, but if they're losing hair from the shaft, which means if the hair is breaking, if you can see that club at the end of a hair, if you're losing it from the scalp, then the problem is deeper. Right. Then the problem is nutritional or hormonal or a combination of both. Right. So that's when you'll have to come to a dermatologist to see what's really happening. But just for brittle hair during the monsoons, good conditioners. Sometimes hair are so frizzy because of so much buildup and all these hairstyling procedures that a simple conditioner also doesn't do the trick. Okay. Then you have these pre-shampoo washes. So they're called masks. So you can use a hair mask for about 20 to 25 minutes pre-shampoo, then do a shampoo, then condition. But
what do these hair masks entail?
The same thing as conditioners do, just in a thicker clayey form. So they're more cream-based. They're thicker formulations. The good ones come with a combination of ceramides and pea protein, various proteins, amino acids, and ceramides. So they basically try to lock in moisture in the scalp.
Understood. Okay. And do you have a say on leave-in conditioners for men and women both?
So I personally am a fan of leave-in conditioners because it's one step less.
Yeah.
Plus, for somebody who's having active hair fall, the conditioning part really gives them more hair fall because hair sticks together.
Right.
And matted hair falls more than individual hair will. That's a golden rule.
Okay.
So there, a leave-in conditioner which you just comb through, it does make sense. Then again, if you have very frizzy hair, stick to a regular cream-based conditioner. If it's even more, if it's extremely frizzy, then switch to a mask.
Okay.
So leave-in conditioner, regular conditioner, cream conditioner, and your mask. This is the gradation based on how frizzy your hair is.
Okay. Noted. Now tell me, you are the one who introduced me to this. I had no idea about it. The fragrance and additive colors in,
Yes.
say, shampoos to make him more attractive or kid-friendly or,
Correct.
more buyable. Like, what is that really harming the quality of these products?
So, truth be told, when it comes to hair care, not so much because the contact time for a shampoo on your scalp is 2 to 3 minutes.
Right.
5 minutes for a medicated one. So, you're not causing too much damage by adding fragrance. In fact, a lot of people in the cosmetic industry, this is called a bloom. When you shampoo with something and you leave the washroom and you re-enter, you will have this fragrance in the washroom.
Okay.
And your hair will keep smelling of that the whole day.
Yeah.
So that's called a bloom.
I quite enjoy that smell. Yeah.
Everybody does. So you like it. When you go under a fan, you'll suddenly have that lovely fragrance of what you what you put on your head in the morning. But when it comes to skincare, which is going to stay on your skin for a longer time, I'm not a very big fan of color or fragrance because these are all additives. And these additives, while they add to the cosmetic look of a product, they don't suit everybody's skin. So, for example, if somebody has sensitive skin, you're anyways more likely to react. So, recall to the inflammation bit that we spoke about.
Right.
Your skin's inflamed. I'm adding something to the mix which is not needed in the product. It doesn't add any value to my product except for the emotive part of it, right? Like emotionally, you go to a product and see, okay, this is blue in color, I love it, I'll pick it up. But it adds nothing to the product as such.
Right.
So I'm not a big fan of color or fragrance added to products, especially because, like you said, my grandfather, for example, used to bathe with a very famous Unilever soap, which is red in color. You know the name. Ends with boy.
Yeah.
And he used to tell me, you get these lovely products at home, but I used to have a bath with a 40 rupee soap.
Yeah.
Because he could afford to. They had better lifestyle, better diet. Even the food that we have nowadays is not as organic as we think it is, right?
Right, yeah. Everything has in hormones or something added, preservatives added to it.
And even if I look at decade-wise since I've been practicing, every passing 5-6 years, we see more sensitivity coming in at younger age groups.
Okay.
So this is the time where we should move towards clean skincare and skincare which is transparent.
Yeah.
I want all my ingredients to be mentioned on the label in percentages.
Yeah.
And that's when I
like The Ordinary does. That I quite like that because it's like no bullshit, right?
Correct.
It
has
has
many other brands do it.
Like,
obviously we're not taking any brand names, but this is a non-sponsored podcast.
Yes, non-sponsored podcast.
But yes, you're right. They're one of the few ones to change the game with percentages. Otherwise, so prescription medications like the ones I've given you, they always have percentages. Go home and look at what I've given you. You'll find percentages and the order in which the ingredients are. So the ingredient in the most concentration always comes at the top, and then you have in descending order the other ingredients.
Yeah. Okay.
So for example, if I've given you a 1% salicylic acid serum, that will come somewhere in the second or the third last line.
Okay. Cool. So, I'll actually check that out.
So these are a few innovations which happen and they change the game and they change the face of how skincare is. So definitely, I think transparency is key, cleanliness is key, and not adding gob to a product which is not needed.
Yeah.
Like no emotive ingredients. I want only functional ingredients in my products.
Okay. Well, you mentioned sensitive skin. How many 1 out of 10 people have sensitive skin? What do you think the statistic is?
More. I would say roughly between 4 to 5 people even. If you look at statistics, sensitive skin is around 33-34% of the population.
Wow.
1/3 roughly.
And do you recommend that they see a dermatologist?
I do, or they can use clean skincare, non-fragrant, non-odor, and even when you're using actives in people with sensitive skin. So sensitive skin means the barrier is disrupted, like I told you.
Yeah.
Right? They're not able to hold in water, not able to protect themselves from the sun, regular stresses of life. So I would want good layers on the skin. I would want something which creates a nice, lends back hydration to the skin, repairs the barrier, and something which doesn't let foreign bodies penetrate and water leave.
Got it.
So it's a to and fro biphasic membrane which I want to rejuvenate by using a skincare product.
Right.
Also, when I'm using actives, I don't want them to be very high in concentration.
Okay.
So, for example, if you can tolerate a 2% salicylic acid,
Yeah.
for somebody with sensitive skin, it will be 0.5%.
Okay.
Because
and the only way to determine that is by trial and error, or
by trial and error, or by reading pack sizes, or having a single consult to see. So many of my patients come in just to see. I call that skincare adjustment. They come in with products which they feel will work well on the skin, versus me when I tell them, okay, this instead of this, replace this with this. So that's usually something that can be done.
got it. And really quick, this is a myth that I held on to for majority of my life. So I used to think shampooing too much will, break my hair and cause hair fall. That's not true, correct?
That's not true. In fact, if you have a very oily scalp and you're not using a sulfated shampoo, you'll actually have to shampoo 2 to 3 times a week for sure.
Okay.
But yes, there's one caveat to that. If you're using a very heavy sulfated shampoo, alternate days or more than 3 times a week, then it becomes a little bit of an issue, because
Right.
you'll cause hair breakage.
Sulfate shampoos are mostly dandruff shampoos.
Exactly. You've got what I'm saying.
Right.
So all your anti-dandruff shampoos, oil control shampoos, these are all sulfated shampoos. There are newer molecules now which are non-sulfated also, but globally, and if you look at studies and from my own experience in patients, the sulfated ones work much better, albeit once a week. So I always layer products, right? So I'll tell my patients to use a sulfated shampoo once a week and a non-sulfated shampoo once or twice a week in addition.
Got it. So sulfate shampoo once or twice a week. That's the limit you
For
prescribe.
anybody with an oily scalp.
Gotcha. Now tell me, okay, we were talking about sun protection.
Yes.
Tell me, does sun protection factor 30 to SPF 50, does it really make a difference in this increase of 20 SPF make a difference in the UV rays that harm your skin?
This is going to be my favorite question on the podcast today.
Great.
So, sun protection factor, like you rightly read, is a marker of how much. So, when you look at UV light, you have 3 main areas, like 3 main wavelengths which come to the earth.
Right.
One is UVA, one is UVB, one is UVC.
Okay.
Just to put things early. So what happens with UVC is it is blocked by the ozone layer, which we are depleting as we speak.
Yeah.
So maybe one day we'll be prone to that as well, and skin cancers would increase.
Yes.
Because that's how potent ultraviolet C radiation is.
Okay.
But when you look at A and B, A is the one which penetrates and it causes us to pigment more or to tan. UVB is the one which causes us to burn. As Indian skin types, we tan more than we burn.
Okay.
SPF is a marker only for UVB. SPF does not tell you how much UVA is being blocked by the sun.
Oh.
So I'm a very big fan of SPF plus a PA protection. PA is protection against UVA light.
UVPA, but I've never read a PA protection
Exactly.
on any product.
Because people are, we call this the SPF game, where people are obsessed with SPF now. They want SPF 150 in their sunscreen. There's a brand which has an SPF 130 as well now.
I can't imagine that's good for you.
It's not bad. These are tested products. These are prescription products which are tested. They're not bad. But my point is, and I don't know if you heard, in the last 2 years, there was a big fiasco over a brand which claimed to have SPF 55, and they tested in individual independent labs. Not like the non-governed labs, and they found that the SPF was not even 15.
Really?
So people cheat as well. That's what happens with a less regulated market. Over the counter is even less regulated than prescription is in India. So you can get away with a lot of things if you want to.
Okay.
So that's why I always say trust ethical brands, trust the process, trust brands with a good R&D team, not just me-too products like somebody who's.
But how does one tell whether the product has a good R&D?
Comes from lineage. So you need to see what kind of products they have. Do they have innovative products? Do they have something different? Whether the first brand to launch something. So those are things which separate them. Or if you look online, you'll find a lot of information on these things, or come visit your nearest dermatologist. I think that's the easiest thing to do. Let them do your dirty work, right?
For sure.
But yes, coming back to the SPF point.
Yeah. What does PA mean very quickly?
PA means protection against UVA light.
Okay.
PA. It
PA.
comes as PA, and then it has these pluses in front of that, the plus sign.
Okay.
So a 4 plus means absolutely it is between 18 and 20.
Okay.
Which means that's the highest rating you can get from UVA. It's about 97 to 98% protective against ultraviolet A radiation.
Gotcha.
So you will not tan if you use a PA++ sunscreen.
Okay. Got it. I think many Indians care about not tanning, so that's
of course
great.
that's why we use sunscreens, right? We're
Yeah.
not as prone to skin cancers as the West,
Yes.
as Caucasians are and other races are.
Touch wood.
But we're really, touch wood, seriously. But we're really perturbed about tanning, right? Any sun holiday you take, no matter how much protection you've used, you do tend to tan more when we go on sun holidays.
Yeah, definitely.
So coming back to SPF, the interesting point is that when you look at SPF 30, so the SPF stands for sun protection factor, like we said.
Mhm.
The number 30 means how many minutes extra can you spend in the sun without getting burnt.
Huh.
Which means it's marked with 0. So SPF 1 means I can spend 1 more minute in the sun without getting burnt. SPF 30 means 30 minutes. 50 means 50. So it's not minutes, it's actually 50x.
Okay.
How many times more can I spend in the sun if I have an SPF on?
Wow.
But if you look at the percentage that is blocked, an SPF 30 blocks 97% of the sun rays, and SPF 50 blocks around 99% of the sun rays.
Okay.
And if you look at SPF 55, 60, 90, it's 0.2 to 0.3, which means that's hardly any percentage. And any which ways, you can't block 100% of the sun.
Right.
The rest of the 1% has to be done by physical protection, which we never do.
Yeah, I mean,
wide brimmed hats, full sleeves, and
correct.
Difficult to do. I wouldn't do it myself on a beach holiday, but at least I know it should be done.
Yeah, I wouldn't do it either. But that's riveting that SPF 30 to 50 blocks what 2% more UVB.
Not even that. So what I was actually saying was between SPF 30 and 50, it's under 2%.
Under 2%.
Yeah, it's just about 1% protection that you get extra.
Okay.
That also I'm being very. There are studies which have shown that SPF 30 can also block about 98%. I'm being very disparaging, and I'm being very, very open-minded about studies.
Yeah.
The max that you'll get with that 20 figure extra is 1%.
Cool.
But beyond 50, you'll just get 0.2. So between SPF 50 and SPF 150, I'm going to get 0.3 to 0.4%. And the prices are going to be 4x.
Yeah, I was just going to come to the price factor.
So
higher the SPF, higher the price always.
That's the promotion, right?
Yeah.
I mean, everybody's got to earn. But the thing is, do you need it?
Yes.
So I have a lot of patients who say we want to apply sunscreen only once. Now, that is the only place wherein a higher SPF would actually protect you more. Because you have, instead of 50x, you have 100x the time duration that you can spend in the sun. So you can go into the sun longer than you can if you just have SPF 50.
Definitely.
But my point is, if you're out in the sun, you have these nifty sunscreen applications now. Just apply it again after 3 years.
Yeah. I mean, yeah, for someone going on a beach trip or a holiday, that's the recommended thing to do.
It's trending. It's absolutely woke to apply sunscreen.
Yeah.
Or it should be.
I guess it should be. It's a habit I'm trying to become regular of too, but it's hard, definitely. Because if you're out and about, I'm not going to carry my sunscreen with me.
I agree.
And yeah, so it's just a habit you have to take into account on a daily. Okay, moving on. Let's talk about nutrition.
Okay.
I came to you, and the first consultation was I want a natural shampoo because
Absolutely.
I don't know what kick I was having out of. I'd seen a bunch of YouTube videos.
Yes.
And before nutrition, I'd actually like to dabble in this area. Do natural shampoos with that are made at home with cloves and turmeric and all sorts of ingredients. You'll find 100 YouTube videos.
Absolutely.
Are they really effective? I know there's no lather in them without a little bit of baby shampoo or something.
You have to add some soap, right? Some saponification has to happen. Some emulsifiers to make them soapy.
Exactly. So what is your opinion on these natural ingredient shampoos?
So I always tell my patients, this whole natural thing started post-COVID because we didn't have access to too many things. Not much research was happening during that time on skincare because we had bigger battles to fight.
Yeah.
But what happens when you apply natural products? See, everything that is in your kitchen can be used on the scalp or the face, right? That is
Correct.
that is what home remedies tell you.
Hmm.
What they don't tell you is which of these can burn. I've had people apply lemon on the face and burn because of the acidity of it, or
Yeah.
apply toothpaste, which is too basic, it's too alkaline.
Yeah.
I've had people with burns, like literally coming to me with burns, and I'm treating them for that.
Okay.
The problem is, how do you know that particular thing which you're using in food as an additive, as a spice, as a condiment, how do you know what percentage of that is good for your skin?
True.
Is it filtered, distilled? It all can't be good. I can't just apply a piece of jeera or lemon squeezed
or
on the face.
squeeze a full lemon on your face.
Vitamin C is great, but what percentage of it is great?
Yeah.
You won't see any preparation more than 25% in the market.
Vitamin C is good internally, I'm sure, but I don't know about
It's good as a serum also. It gives
It
you
is.
that added glow. It's also a good SPF booster,
Okay.
if for whatever it's worth. But yes, applying lemon on the face does not equate to applying vitamin C, because it's acidic also. Why pharmaceutical companies and over-the-counter companies, why skincare brands do so much research is to distill it and make it pH balanced. The skin pH is 5.5. The minute you deviate from that, you're either going to peel or burn.
Correct.
Which is exactly what lime juice, which is acidic, does, or toothpaste, which is alkaline.
Right.
You have to maintain that pH balance. So, more often than not, home remedies will irritate you more. They have these caustic irritating agents because that is 100% that you're using.
Yeah.
So, what we try to do through skincare is filter it out and give you just the right concentration, which is safe for the skin.
Yeah. Okay, yeah, that makes sense, because you don't want to fall prey to a home remedy gone wrong and then end up at your
Absolutely.
dermatologist.
I can share some photographs with you, but obviously nobody wants to see
Yeah.
gory stuff. But literally burns from a simple toothpaste which you use in the morning, right? Something as harmless as that. You won't even look at your toothpaste most of the days,
Yeah.
but it can cause little damage on the skin.
I'm wondering who has used a toothpaste on their face and come to you, but that's quite a story.
These are real stories, and these are educated people, by the way. I'm not talking about people who don't have access to stuff.
Yeah. Yeah,
So
the
it's
most
just-
educated people can fall prey to this. Yeah.
Anybody can fall prey. We're human after all, right? All our scientific and logical minds take us only thus far.
Yeah.
After a certain time, if your best friends told you, okay, toothpaste, this is what you have to do.
Yeah, I would probably give it a try.
Exactly. So don't.
Yeah.
I mean, there's enough research, and there are enough documentaries, podcasts, so much information
Yeah.
floating around in the internet. Make full use of that.
I agree.
Follow the right people, listen to the right advice. I think that will take you far.
Absolutely. Okay, coming to nutrition, my favorite. I have been so I'm doing this thing called the 75 hard right now.
Okay.
So which is like a couple workouts a day.
Okay.
And it's mainly strict. Obviously, no drinking, smoking, whatever.
Correct.
But it's mainly strict on your diet. It's only home cooked meals and obviously no processed food, no sugar, all of these things. So it has helped me with my skin a lot. Tell me which vegetables or superfoods you think do wonders to skin to make it glow, reduce acne, all of that.
Okay. So none of these foods cure anything. First of all, nutrition is a lifestyle. It's like a diet or working out. These are things which you have to do for a long time to be able to see plausible results.
Yeah.
But things which really make you glow are foods rich in antioxidants. All your berries.
Yeah.
Anything which is green in color, anything which is red in color. These are classically foods that have a lot of beta carotene, antioxidants, and antioxidants in general will. Another part of aging, acne, alopecias, a lot of skin diseases is oxidative stress. Where your cells. So I told you, when you don't wake up in the morning, when you don't sleep properly, when you're doom scrolling, like you mentioned.
Doom scrolling, yes.
So you will wake up with high cortisol levels, right? So your body is stressed. But even at the level of a cell, your cells are also stressed. That cell stress is called oxidative stress.
Okay.
So these antioxidants remove those free radicals and make your cells less stressed. But like I said, it's not curative. It's more preventive. This is called prejuvenation, to be honest.
Yeah.
So, like I said, any foods, so all your superfoods, like you get this, the seed mixes nowadays. They're fantastic.
Like sunflower seeds.
Sunflower seeds, flax seeds, why not? They're healthy. Chia seeds. Flax seeds are also a very rich source of omega-3.
Right.
Omega-3 is also something which is great at anti-inflammatory actions.
Yeah.
And most of the diseases we see in skin, in dermatology, are inflammation, immune-mediated.
Correct.
So you would want something to reduce inflammation.
Is beetroot something you have a strong opinion on?
Very for women with low iron levels, beetroot is a very rich source of iron.
Correct.
Again, a good antioxidant.
My mom has been forcing me to have beetroot and having it herself too.
My cook makes these beetroot paranthas. They're very, I mean, the paranthas with low
Purple parathas? Are they?
Yeah. They're quite nice. I mean, I can't honestly tell the difference.
Have to give it a try. Yeah.
But obviously, there's not too much beetroot in that. Beetroot juice is a little extra, but beetroot in your salad is a good add-on, right?
Okay, that's good. So have berries, have your veggies, have your green veggies, all
Yes.
the superfoods. Let's move on to meat. A
Okay.
lot of young people, and actually there's a whole fitness wave taking over the internet.
Yes.
Everyone wants to get fit. Everyone's been promoting weightlifting, weight training,
True.
and to supplement that, you need protein.
Absolutely.
The most popular form of protein is animal protein, right?
Wait,
And not in a vegetarian city such as India, but throughout the world. Meat takes a toll on your skin sometimes. It increases heat in your body, increases inflammation. How do you suggest one finds a balance between reaching their protein goals and keeping their skin healthy?
So again, a lot of diet depends on what you grew up digesting. That's what I really believe in. That's like the famous paleo diet and all. They base themselves on what you ate growing up.
I'm sorry, you said paleo diet?
Paleo diets. They were quite popular. These diets essentially tell you that you should go back to eating what you ate as a kid. So, for example, I grew up in Delhi. So, I should essentially eat the same foods that I grew up eating.
Okay.
It's difficult to do. It's it's impossible for me to do now.
Yeah.
But the fact is that if you're able to digest something bachpan se, like when you started eating food, you could digest certain foods. I've been a non-vegetarian since I was born.
Yeah.
Like, since the very beginning. So
Right.
I know I'm able to digest chicken very well, probably even red meat very well.
Yeah.
For me, it won't be that much of a problem.
But one would say that eating the same things when you're older is harder for your body to process.
It's harder for your body to process, I agree. Which is also why people are moving away from fatty meats. You're moving more towards lean meat because all of us want more protein from our diets. When you have a lot of fat in your meat, that also adds to the calorie quotient and definitely gives you more added calories, which are dead calories. They taste better, obviously, but they're dead calories in the end. Moving to a lean source of meat like chicken or moving to something like seafood. Again, skipping prawns, moving to fish, moving to salmon and things thereof. I know you're blank because I don't think you eat.
No, I have salmon maybe once or twice a week. But
exactly.
I'm just wondering whether that's feasible for
That's what I'm saying. If it's feasible. If not, like I said, nowadays you have added supplements, right? Even when you have a lot of lean meat, you might not be meeting your protein requirements on a daily basis. For example, if you're
chicken breast rather than chicken thighs is harder to reach your because it doesn't, and it's harder to eat too.
Muscular, right? I mean, the more when we talk of lean meat, we're talking of muscle.
Yeah.
The more muscle your meat has, the more the more protein you'll get from it.
Right.
But again, like you mentioned a while back, so how heavy are you, if I can ask you on camera?
I weigh 71 kgs.
And you're doing these double workouts in a day, high intensity?
Yeah, weight training and some sort of sport.
So you should ideally, as per guidelines, be eating at least 1 gram per kg?
Definitely, 1.5.
Or more, exactly. Since you're doing HIIT along with that, working out twice a day, you should be doing at least 100 grams of protein in a day.
Definitely.
No matter how many eggs you have, how much chicken you have, you will need some supplements along with that.
Yeah, I have whey protein for sure.
All of us do. And that's something we shouldn't shy away from. The problem comes when you start overdoing it.
Yes.
Now, I have people who will not take anything from the diet. They'll have 3 scoops of whey protein. That is dairy.
Yeah.
Whey and casein are 2 big proteins which come from milk. Anything which is milk derived can give you acne.
Right.
I'm going on camera and saying this. You start increasing. In fact, I'll tell you my own thing. The day I have 2 scoops of protein, thinking that I'm going in for a very heavy workout or an endurance swim, I will break out within the next week.
Okay.
So if you're sensitive to that, the insulin pathway, like I told you, then you remember I told you insulin receptors,
yes,
and they're targeted by paneer or anything dairy, fermented and unfermented, then you will be more prone to acne. And that's just from a cosmetic standpoint.
Okay. So one must stay cautious of consuming dairy and especially overdoing whey protein.
So I'm saying get most of your protein from diet. 20% should be supplement.
Do
Not
you
the other
work
way
out
around.
regularly?
I have started now.
Yeah.
It hit me a year back, which is why I'm so keen on nutrition, which is why I ask all my patients as well.
Yeah.
Now, I have seen a sea change in the past year. I'm still another 10 kgs or so away from my target weight. But yes, it has changed life for me, and it's something which I really prophesize. Like, I think we should be fitter. The fitness will be something which is great, but pick and choose. There's a lot of misinformation there as well. A lot of people speaking without any expertise.
Yeah.
Which is why I never come on and speak about nutrition, because I don't think I'm a true expert there. There are people who are well-read in the field and who should speak about that.
Yeah.
Whereas there are fitness enthusiasts who should come out and speak about
Most
these. But
definitely.
definitely all of us, because we do it personally, we should have an inkling as to what we're doing.
I agree. And I propagate fitness as well. Getting into it definitely makes you want to clean up your diet.
Absolutely.
Do you think being a pescatarian is better than being all-out omnivorous animal?
Definitely. And seafood, especially fish and salmon, like we were discussing, very rich in omega-3 again.
Yeah.
Very rich sources of omega-3. So nowadays we're moving to that genre where omega-3 more than omega-6 is what you need. You need a good ratio of 3:6. 3 should be much higher than 6.
Okay. Gotcha.
And most of the foods that we do, most of the oils that we have, they have more 6 than 3.
Really?
Yes.
Okay. Do you suggest for a vegetarian to take supplements of omega-3, 6 and
I do. You get vegetarian re-engineered capsules as well. So omega-3 is broken down into 2 sub-fractions. One is EPA, eicosapentaenoic acid.
Jeez.
Yeah, exactly. And DHA.
How do you remember these names? It must be a lot of practice. Yeah.
And this is not scripted, so I'm glad I remember it.
I'm glad as well. One must be taking notes while watching this.
And the other one is called DHA. That's even tougher. That
DHA.
is docosahexaenoic acid.
Okay.
So EPA, DHA, these are the 2 components that make omega-3 that you're getting from omega-3. And anywhere between 500 milligrams to 1 gram is what you are supposed to take. So vegetarian capsules bhi hai, but we don't know if they're as good as taking the real deal. So I do start my patients on omega-3, but again, the source is fish oil. Cool. Somebody who's a hardcore vegetarian, they might not want to have anything derived from fish. So that becomes a little bit of a challenge. But like I said, vegetarian sources are available.
Okay. Wow, that's quite insightful. Okay, let's segue in this conversation into someone watching this who is in a visual medium as a profession, say an actor. You treat actors and
yes, you've seen them at the clinic.
Yes, and other sort of social media influencers and whatnot. They require to look
people in the public eye.
Right. They require to look good, have clean skin.
Yes.
And oftentimes their lifestyle is such that they can't take all the wonderful advice you have given.
Absolutely.
Earlier. So they must resort to acne peels, different types of maybe Accutane.
Yes.
What are your thoughts on Accutane? I would like to know.
So again, Accutane is FDA approved. Accutane is isotretinoin, the salt, and that was FDA approved for acne the year I was born. So 1982, which means it spent 43 years in the segment, in the spectrum.
Right.
Some of the most horrible cases of acne can be treated only with isotretinoin and nothing else. I myself have taken isotretinoin as a kid. That's partly the reason I had horrible acne growing up. I had grade 4 acne. My father was also a dermatologist.
Oh, wow.
So I grew up taking isotretinoin for a year and a half, in fact.
Interesting.
But yes, for milder acne, it's not something we start off early on. It does come with its side effect profile. It is contraindicated for women who are actively planning to conceive. It does come with its side effect profile in the lower age group when you try to give it to pre-teens, when you try to give it to patients under the age of even adolescents for that matter. So,
is that prevalent? Do pre-teens really come in for Accutane?
See, sometimes they don't come in for Accutane, but sometimes if they have grade 4 acne, like I told you, those bulging cysts and painful acne, which is going to scar very badly, then you do need to at least inform them about isotretinoin. But it has some issues with, like fusion of joints. So basically, it will help you, it will stunt growth to some extent. It has this, side effect which is specific for joints, so it can give some joint pains in especially in younger age groups or higher doses.
Okay.
But like I said, for people who are not responding to any other medication, and for people who have very severe acne and people who are scarring, it is a drug of choice across ages.
Okay.
So it's something which I'm very, very privy. I give it a lot in my practice. It's a lifesaver for me, for many patients who've taken it. But yes, it comes with a long list of lawsuits which have been filed against it. It's earned a very bad name,
Yeah.
even though it isn't. If it's given in the right dose by the right prescriber to the right patient, it's a lifesaver. It's a wonderful drug.
Has there been a case with you where you have given a bit more to the patient than they could handle, or just messed up the quantities in any sort of form?
Not really. So as Indians, we don't use as high doses as the Western world uses.
Okay.
We are privy to using lower doses of isotretinoin.
Is that because of a higher quantity of melanin, or is that just?
It's just a sensitivity thing where we are a little more sensitive.
Cool.
So most Indian dermatologists will not use a very high dose of isotretinoin. Again, unless sometimes you get this acne which comes with fever and constitutional signs, and it's a syndrome. Like you have multiple things coming together, where acne is one of them. There you have to go supremely high.
Okay.
So yes. So like I said, even though isotretinoin's earned a bad name, people who benefited from it are
They are living life,
plenty.
alive and kicking.
Kicking very well, I'd say.
Okay. Amazing. And apart from Accutane, which other procedure would you say is most popular that patients come in for the most, or you prescribe the most? Because it has been revolutionary in the dermatology world.
For me, two things for acne which I find are revolutionary in terms of procedures. One are chemical peels.
Yeah.
You have a lot of fantastic chemical peels now which are gel based and nice, so they don't react as badly as people used to before. So they're easy to come out of. We call this downtime. Downtime means I do a procedure for you. You have to stay at home for a couple of days, or how long you can see the visible effects of the procedure.
Yeah.
So with newer chemical peels, the downtime is very less, like less than a week. Whereas when I started practicing, we used to have peels which had downtime of 10 to 15 days.
Yeah.
Which is time which people in the public eye can't take off. So nowadays you have non-peeling peels, you have simpler peels, you have peels which you can conceal with a moisturizer simply. So there are better things. We move forward when it comes to peels.
Are these pain-free?
These are pain-free. Peels are absolutely pain-free. They just change the pH of the skin, exfoliate it and get it back.
Okay.
So that's it. And the second procedure I like a lot is a laser called a Q-switched laser.
Okay.
So these are called they have a microsecond mode, again little technical, but they're called acne modes. So they're very, very good in heating up the oil gland and reducing the size. So they reduce the concentration physically by using a laser modality. And that is no downtime. So patients get it done in the morning, they sometimes have shoots in the evening, and they're absolutely ready for a shoot.
Okay.
So these are no downtime procedures. They're called office procedures. People walk in, walk out without any problems. Older chemical peels, severe chemical peels, yes, 3-4 days downtime is definitely there.
Yeah.
But can be managed.
Okay. There's a stigma around these peels that people say that they make the patient vulnerable and dependent on these peels. So if you get it done once, you must get it done again. How true is that?
That's the biggest myth. That also happens with skincare, with things like minoxidil. That happens with a lot of these things which are... So when you look at most things dermatology, we're trying to treat things at the root. We're trying to look at root causes and treat it as deep as we can.
Yeah.
Once you stop using it, it'll come back, because we're battling things which last for a long time. If somebody starts losing hair, they're losing hair for a very long time if it's hormonal and genetic, right? Which is something like pattern hair loss or male pattern balding like we commonly see.
Yeah.
You're fighting the disease. If I'm giving you something which is treating at the root cause and you stop it, it won't make it worse, but the disease will catch up after some time.
Okay.
So you're buying time with these things. Let's put it that way.
Okay.
But yes, there are certain types of hair fall which are fully controllable. There are some types of acne which are fully treatable. So in those things, once you use the products, you get better, it won't come back.
Speaking of hair fall, I see a lot of my friends who are dealing with hair fall at this age, and they are genetically bound to lose hair.
Correct.
Let's say it like that. And they are very scared. I must say. They are really frightened by the fact of being bald in their 20s or early 30s.
It's terrifying.
Yeah.
There's no doubt about that.
It's nerve-wracking, yeah. And is it fixable? Can you escape your genetic lineage in terms of hair loss?
That's a tricky question. You can't escape genetics for sure. And if your genes are very strong, if you start losing hair in your teens, we're seeing young patients. I had an 8-year-old girl come in a couple of months back with pattern hair loss. Like
Really?
advanced. If I show you the photo from a top, you wouldn't be able to make out that she's an 8-year-old. So yes, sometimes you can't escape genetics, but for the better part of it, if you start treatment early, you're buying time. Like I said, this is a disease which is going to spread on its own. It's going to progress, advance. If you started losing hair in your 20s, there's likely nothing which is going to stop you from losing hair in your 30s and 40s till you're completely bald. So you're starting people on medications, on lotions, or on procedures which are buying time. But the time has to be bought till you need hair.
Okay.
A lot of times what happens is people get good results and then they stop it, thinking that this was a one-off thing. Hormonally mediated hair loss starting at the age of 20 is not a one-off thing. It's going to continue with you for the rest of your lives.
And stopping it could be, in turn, very harmful.
Exactly. So it won't make it worse, but it'll reverse it. So you are buying time. Let's say I use I use a protocol for 20 years and I stop it at the 21st year. I will lose hair 21 years later.
Okay.
So I wouldn't have changed the disease course. I would have bought some time and softened the blow of the disease, but I wouldn't have prevented it. We still can't cure these things, right?
Okay, yeah.
We're far away from curing things. There is research on hair cloning nowadays. Cloning, like
Meaning?
3D printing.
Okay.
Hair cloning. So the day hair cloning comes into play, maybe we won't have to talk about hair anymore.
Oh, inshallah.
If we ever, I don't think we'll live to see the day.
Yeah.
But let's see.
I mean, is it really that far into the future that you can expect hair cloning?
Research is happening by a society called the European Hair Research Society, and that started in 2012. I heard that lecture firsthand in Barcelona.
Okay.
But it's not moved too much from there. But who knows? Who knows?
Amazing.
The way we're progressing and with artificial intelligence coming in, maybe somebody will crack the code and
hope so.
Let's hope so.
And what are your thoughts on hair transplant or anything in that area?
So exactly. So when you talk about things like hair transplants, again, you're transplanting hair from an area which is non-hormonally mediated into an area which is hormonally deficient.
Like what? Can you take your leg hair and
No. The back of the scalp. This area is protected by hormones.
Okay.
Have you seen a lot of people with male pattern baldness? They have this. It's called the Olympic wreath. They just have this portion left. Everything else is bald.
Like the side of
the sides and the back.
Yeah.
So these are androgen protected hair. They are hair which resist hormonal imbalance.
Okay.
But the whole crux of the matter is that when you put these hair in front, in an area which is susceptible to androgens, they become thin. They start behaving like so the donor hair start behaving like the recipient hair.
Okay.
That's called recipient dominance. So transplants will also last you only for as long. There are nowadays when you look at how long a facelift lasts you or how long a transplant lasts you, there are like 10 to 15 years.
They come with an expiry.
Exactly. It's not lifelong. It's not permanent.
Cool.
And even to maintain that for the said duration, you need to be on medical therapy.
Okay. So it's not a one-stop fix at all.
It's not nothing in dermatology is now a one-stop fix.
Okay.
Even something like...
That's kind of heartbreaking for patients.
It is. But the thing is, the journey is comfortable now. There are easier methods of doing things. Back in the day, we had just, one solution available. Now we have tablet formulations, we have sprays, lotions, gels, easier, like methods which can be applied easily in one's life. But it takes consistency. Anything in skin takes a lot of consistency.
Does your clinic provide any service for the hairline? I forget what it's called. It's hairline relocation or something.
Yes. So different things. It's called hairline correction, hairline designing. They're all a precursor to hair transplantation.
Yeah.
So we do have consultants on board.
It's a precursor, so you will have to get a transplant at the end of the day.
Exactly. So there are certain hair procedures like platelet-rich plasma, growth factor concentrates.
Okay.
You have newer things in this field like exosomes. We have some lasers which work for hair loss. But again, these are all done at the right time. If you do them too late, if you do them by the time you're bald, none of these things can reverse it.
Yeah.
So you have to start
early.
You have to preempt it.
Okay. And for my poor friends who are worried about losing their hair, can you give some tips as to just simple tips that they can do at home right now in terms of washing and conditioning their hair?
So absolutely. So see, it all starts from scalp health, right? Agreed. You have hormonal imbalance which is occurring. You have genetic mediation which is occurring. Yes, but scalp health is also important. So while genetics you can't fight, like I told you, although there are people are working on nutrition and epigenetics, how we can change how our genes are expressed by nutrition. It's a lot of good work happening in the field. We're far away from establishing it as a science. It's still called a pseudoscience by most people who don't believe it.
Okay.
But then something's happening there. There's some buzz and some chatter in that field. But to maintain good scalp health is prima facie. That's the cornerstone. So you start with good scalp health and then you seek treatment beyond that. So I think washing your scalp 2 to 3 times a day, 2 to 3 times a week, sorry. Once with a sulfated shampoo if your scalp is very oily or if you have a lot of buildup or if you use plenty of products. And I think using the right shampoo and conditioner, that's something which will really go a long way in scalp health. Sleep properly, eat well, exercise as much as you can. All of these things help us in curbing oil.
Good lifestyle choices.
Reduced triggers, reduced inflammation.
Right.
So these things go a long, long way.
Yeah, well, I hope they do take all of these pieces of advice into consideration.
You're the perfect role model. I mean, I think you followed everything to a T. You were already doing enough. I think when I spoke to you, I didn't have to change much.
Not much, but just a couple of supplements here and there.
Exactly.
This man is responsible for this head of hair, so I'm eternally grateful.
It's my pleasure. Thank you.
So I would like to put this out there for everyone to hear that this myth of, dermatologists prescribing products will make your hair or skin dependent on it is not entirely true.
Is not true at all. That's what I was telling you. So we're trying to help you fight a disease which is very chronic and which is going to advance as time progresses. We're trying to help you arrest it or treat it as deeply as possible.
Right.
But some of these things don't have a root cause that can be treated.
Yes.
And if that is so, the minute you get off the treatment, you will lose results and you will progress. But you won't get worse than you were before. That's for sure.
So it won't harm you in any sort of way.
It will stop doing good when you stop it, but it won't do any harm.
Right. And it's better to start early than later.
It's better to start early. So like I said, that whole concept of thinning hair to balding. When you're thin, your hair are thinning. When you can start seeing the scalp, that's the right time to hit it.
Okay.
When you start balding, it's already a little too late.
Okay.
So that is when your surgical correction comes in. That's where your transplants come in. But as long as you're thinning, your topicals and solutions, hair regrowth solutions, your PRPs, your clinic procedures, your lasers, all of them come into play at that time.
Gotcha. So prevention is better than cure in this case.
Absolutely. That's my favorite line for all things dermatology.
Definitely. Is there anything that girls come specifically for and you've seen an increase in that particular worry or diagnosis?
Acne, yes. A lot of younger girls coming in with acne. I told you, a lot of young girls coming in with hair loss. I think youngsters are a lot more stressed than we used to be. I know this is a generational thing. I think everybody, like my mom would tell me, I'm more stressed than she was. I'm more type A than she was.
It's because of the social media generation. And everyone wanting to look good. Everyone is a metrosexual now. Everyone wants to post selfies where their acne is not.
It's called the filters. It's called the no filter look. I've had patients write that on a piece of paper. We want the no filter look.
Really?
It's trending apparently.
Well, that's really embarrassing.
But I do feel, Khan, if I tell you honestly, I do feel the young ones who come to me, I do feel they're more stressed than we were back in the day.
Which in turn makes their skin worse.
Exactly. So very stressed about what to do in life. And I remember I was telling one of these girls, she's a 13-year-old, a bright young girl, and she came with an entire vision board of what she wants to do when she's 30.
Really?
And I was telling her when I was 13, I didn't even know where my bus stop was. I had to ask my dad the directions to my bus stop. That's how simple our lives were. And I'm sure earlier in the day, they were even simpler. We are moving towards a little more complicated way of living. It's got to give somewhere, and unfortunately, the toll starts happening on your skin and hair. That's the first thing to give way, but it doesn't end there.
Because your body sends signals, and what
Exactly.
better signal than to show it on your face that you look at every day.
That's exactly why the minute you came into the clinic, even though you're fit, young, healthy, good looking, I still made you a chart because I felt I should be the one telling you that your body will tell you what to do when.
Yeah,
And it's important for us to listen to that.
it definitely is. Yeah. And yeah, in a world that's getting only more and more competitive, I hope
Yes.
people seek advice and consultation from their friendly neighborhood dermatologist, from Dr. Aseem Sharma from Skin Saga, and his lovely wife will be there too if you need a female dermatologist to treat you. It has been an absolute honor and pleasure having you on this podcast, Doctor. Is there anything that you'd like to tell the young Gen Z audience about skincare or life in general?
Life in general, no, I wouldn't prophesize, but skincare, yes. I think take it easy. That's the first thing I tell all my young patients. You have a long way to go. We are overachievers. We love it. We're all ambitious, by the way. Both of us sitting here as well.
Yes.
I know you, and you know me. But draw a line somewhere. Have your own time. Spend some time with yourself. That's one thing I always tell, like all people who are young. Keep it simple in terms of skincare. Start low, go slow. Keep adding things once they start benefiting you.
Yeah.
Don't start 10 things together and then jump the bandwagon. Start with one thing, build up on it, keep adding till you feel you're satisfied. That's the right way to go forward, and always be consistent.
Exactly.
Sleep well, eat well, exercise more. I think those are good enough from a skin and hair point of view.
Perfect. Listen to your body and don't go crazy. At the end of the day, it's just a pimple. It'll go away soon enough.
And it's you. Have some fun along the way.
Yeah, have some fun along the way. Thank you so much, Doctor.
Thanks, Kahan. An absolute pleasure.
Right back at you.